possible.
OK, let me just ask you, in the time we've got left, the recommendations of the Cass review on the treatment of young people and gender identity, that obviously is going to fall under your watch, because what Dr Cass was saying is that these young people should be taken into the broader health service and not treated by specialists because they have varied and wide and complex needs in many cases. Are you going to do that in Scotland?
I'm very grateful to Dr Hilary Cass for her very substantive document, her evidence-based document, which we as a government welcomed. You will understand, and I'm sure Dr Cass will understand, that we're now reflecting upon her recommendations, which was of course commissioned by NHS England. There are different pathways in England as there are in Scotland, so we need to reflect upon the recommendations.
How long will you reflect for?
Well, we've given a commitment in the debate last week. Our amendment suggested that we would be responding before the summer recess,
OK.
And that's something that I'm committed to.
Let me ask you then also on that subject about your new law banning conversion therapy. Are you going to go ahead with that? Because doctors have been telling Dr Cass that they fear prosecution if that law goes ahead, just for trying to help patients in their care.
The First Minister said, I think it was on Friday morning, that we are going to look at the consultation responses from the conversion therapy consultation and reflect upon them, but we are committed to continuing with that legislation because it's an important piece of legislation.
OK, well last question to you. You are the kind of top stone in the pyramid in the NHS in Scotland. The buck stops with you and you're the decision maker. Are you going to lay out a framework for doctors that tells them exactly what they can, they should, they must do in this respect? Because they're confused at the moment and they're frightened because it's such a toxic and sensitive subject.
It is, and Dr Hilary Cass made that very statement that the polarised political and public discourse has not helped in terms of taking forward a very sensitive area of public health and medicine. And that's why I want to make sure that in responding to the Cass review, we do so in a measured, evidence-based way, recognising the challenges that there are there for those young people that wish to seek those services, but also for those medical professionals who are delivering those services.